we will be studying the Norma Frontalis of the skull, that is, the anterior view of the skull. In the anterior view of the skull, we can see the frontal bone, the maxillary bones, the paired maxillary bones, the mandible, the zygomatic bone, and in the orbit and the anterior nasal aperture, in the orbit, there is the sphenoid bone, the lacrimal bone, the ethmoid bone, and here is the maxilla. We can also see in the nasal cavity, we can also see the inferior nasal concha, the middle nasal concha, and the superior nasal concha. The superior and middle nasal concha are projections of the ethmoid bone, while the inferior nasal concha is a separate bone. The vomer, that is a different bone. It separates the nasal cavity into two parts. Now for the frontal bone curves downwards to form the superior border of the orbit. Just superior to the superior border of the orbit, we have the superciliary arch, the projection, a curved projection which is called the superciliary arch. On both the sides we have this curved projection, and these superciliary arches, they fuse in the midline to form a smooth elevation called the glamella. These superciliary arches, they're more prominent in a male skull, and the glamella is the point where the glammular reflex occurs. When we repeatedly tap the glamella, we start to blink. This is a reflex that is present throughout your life. Then we have the frontal eminence, which is the primary ossification center. The frontal bone starts ossifying from the frontal eminence. We have the metopic suture that is present in 3 to 8% of skulls. It should not be confused clinically with a fracture. It is basically a remnant of the frontal suture. Here is the frontal suture, and if it persists, it's called the metopic suture. Then we have the nasion, which is basically a depression below the glamella. It is formed by the fusion of the internasal suture and the frontonasal suture. This will be more clear once we get to the nasal bones. In the orbit, we have the ethmoid bone. In the orbit, we have the orbital plates, which are a part of the frontal bone. They form the roof of the orbits, and then we also have a supraorbital foramen, that is this part, supraorbital foramen or notch. It transmits the supraorbital nerves and vessels. The supraorbital nerve, that is a part of the ophthalmic division of the trigeminal nerve, right? It supplies the scalp and the forehead, while the vessels supply the scalp, forehead, as well as the levator palpebra, the muscle that elevates your eyelids. Now that we are done with the frontal bone, we'll come to the maxilla. The maxilla is also a paired bone. It has a projection at the lower border of the anterior nasal aperture, the anterior nasal spine. This anterior nasal aperture, it is formed by the lower borders of the nasal bone and the maxilla. They form this anterior nasal aperture. It has that inferior nasal concha, middle nasal concha, superior nasal concha, and the vomer. Now the anterior nasal spine, this projection, it basically supports the septal cartilage of the nose and is formed by the maxilla. Then in the maxilla we have the canine eminence, which has the root of the canine because it's the strongest and the longest root, so there it forms an eminence on the maxilla. We have the alveolar process of the maxilla, which with the opposite side of the maxilla forms the alveolar arch. The alveolar arch basically provides sockets. It provides the sockets for the maxillary teeth. We also have the inferior orbital foramen in the maxilla. These foramens, they transmit the inferior orbital nerves and vessels. The inferior orbital nerve is a part of the maxillary nerve. It supplies these nerves and vessels, they supply the mid-facial region, the lateral nasal part, the upper lip, and the cheeks. After that, we have the incisive fossa, the maxillary incisive fossa, which is basically lateral to the canine eminence, and it has the origin of the depressor septi nasi, which depresses the nose for the facial expressions. After the maxilla, we come towards the nasal bone. We have paired nasal bones, which form the bridge of the nose. These nasal bones diffuse at the internasal suture, and then this internasal suture and the frontonasal suture, that is between the frontal bone and the nasal bones, they form the nasion, the depression. And the lower end of the internasal suture has the rhinion. The anterior nasal aperture is pear-shaped, so it's also referred to as the piriform. Now, as we've covered the nasal bones, we move towards the zygomatic bone, which is the cheekbone, this part. The zygomatic bone also has the zygomatic arch, which is more visible on the norma lateralis. But the zygomatic arch is basically formed by the temporal process of the zygomatic bone, which is this, the temporal process of the zygomatic bone, and the zygomatic process of the temporal bone. It forms a zygomatic arch. We also have the zygomaticofacial foramen, which transmits the zygomaticofacial nerve and vessels that supply this part on the skin, of the skin. After the zygomatic bone, we have the mandible. The mandible, basically it has a horizontal part that forms the body, so the mandible has two vertical parts that form the rami of the mandible, and a horizontal part that forms the body of the mandible. Just below the second molar, we have the mental foramen that transmits the mental nerves and vessels, which supply the chin and the lower lip. After that, we have the symphysis menti, which is marked as the fusion of the two parts of the mandible in the fetus. Like the mandible forms as two parts and joins to form the symphysis. Joins at the symphysis menti. The symphysis menti inferiorly has a triangular protuberance called the mental protuberance. Just lateral to the mental protuberance, we have the incisive fossa, which has the mentalis muscle that pulls the skin of the chin and moves the lower lip outward for facial expressions. We also have the alveolar part for the mandible, which has the mandibular teeth. It has the sockets, also called as the alveoli, sockets or alveoli for the mandibular teeth. Also, only the mandible has a movable joint. Rest are all sutures. The temporomandibular joint over here, it is the only movable joint. So the mandible is the only movable bone of the skull.